Buenas tardes a todas y todos. Estamos muy contentos con su participación. Esta será una
Good
conversación en
afternoon, everyone. We're very happy with your participation. This will be a conference in Spanish with interpretation into English. For those of you that wish to hear in Spanish, you will find an icon where you can choose the language of your preference, or Spanish.
You will find an icon on your screen in the toolbar that says interpretation. If you click on this icon, you will have the option to choose English. Mi nombre es Carolina Freire, soy especialista de
My
la
name is Carolina Freire. I'm specialist of the Division of Social Protection and Health of the IDBN. And during this next hour, we will share testimonies of protagonists that were in the first line of the response to COVID-19. We will have a panel with special guests and a space for comments and questions. We will also present the flagship presentation titled Beyond Normalcy, the challenges for the health sector in Latin America and the Caribbean exposed by COVID-19. To begin our program, I want to give the floor to our manager of the social sector of IDB, Ferdinando Regalia, for some introduction, some welcoming remarks and context. Thank you very much, Carolina, and thank you all. And we welcome you all, and thank you very much for joining this webinar. Today, we launch our publication, Going Beyond Normal. This publication analyzes the effects of the pandemic in our health system, but also the consequences, the future consequences in terms of challenges, expenditure, investments, operations. It considers new challenges such as the increase in mental health disorders or the effects of long COVID, aside from others that have been accumulated in the past 2 years, such as delays in the detection and treatment of chronic diseases. The publication compiles several research studies, not only by the IDB, that show how, for example, in 2020, the deaths caused by diabetes increased by 14% in Brazil, Chile, and El Salvador. Ischemic cardiopathy caused less deaths in Brazil and Chile, but 33% more in El Salvador. We need this type of information to create new public policies. Our 2025 vision sets an objective, which is to accelerate the economic recovery of our countries. But to achieve this, we know that we need better health and better health services. That is why we have called this publication Going Beyond Normal, because we expect it to be a useful tool to help reform our health system. We do not want to go back to normalcy. We wish for a better future, a future of better access, of better services, and better quality. And that is why we go beyond normal. Thank you very much. Thank you very much, Ferdinando. Next, we will show a video with testimonies by physicians, health professionals in the region on the challenges that they have faced during the pandemic.
Los médicos nos sentimos al principio, yo diría, muy tristes, porque la medicina que habíamos aprendido no curaba. Lo que funcionaba siempre de una forma para tratar los síntomas que tenía el coronavirus, teníamos que aprenderlo de vuelta. Si algo bueno dejó la pandemia es poner la salud mental sobre la mesa. Los médicos son parte de la sociedad y vivían lo mismo que vivían sus propios pacientes. Comprendían la ansiedad porque la estaban viviendo, el miedo a enfermar, el miedo a contagiarse.
Saber que obviamente en el contexto de una pandemia nosotros estábamos desfortalecidos, estábamos desarmados la medicación escaseaba, el oxígeno, el suministro de oxígeno también escaseó, el manejo de o la cantidad de ventiladores mecánicos no daba abasto para la cantidad de pacientes que nosotros teníamos, entrar definitivamente en un protocolo de guerra, ¿no?
Era muy triste ver a la gente también cómo llegaba demasiado deteriorada. Ya no se podía hacer muchas cosas en algunos casos, ya que su enfermedad se estaba totalmente muy avanzada, ¿no? Por la falta de personal, pues trabajábamos 16 horas al día, ¿no? Por 5 días. Entonces, sí era muy cansado y pues yo creo que para que el demás personal desertara fue eso, ¿no? Que el temor principalmente y pues cuidar a su familia, ¿no?
Cuando empiezan a llegar ya los primeros pacientes con infección por COVID-19, pues el ambiente en el hospital, me acuerdo que era de una zozobra, una angustia, pues porque al mismo tiempo era la preocupación no solamente de lo que estaba pasando, sino también de nuestras familias. Cuando ya empieza a aumentar y aumentar, eso fue terrible, o sea, tener desbordado el servicio de urgencias. Entonces ahí fue cuando empezó a suceder lo que a mí me pareció de las cosas más horribles, y fue tener que hacer comités de priorización. Entonces nos sentábamos a decidir quién tenía opción de entrar a la UCI.
In my case, the biggest fear was actually losing a loved one. I didn't lose a loved one through this pandemic, but however, I always knew that I am a high-risk individual, meaning that I would be directly exposed, so therefore I had to take precautions. But the biggest fear was carrying home this, I didn't want it to reach at home, to meet my children, to meet my husband, and I actually have elderly persons like my mothers and aunts.
Aún no hemos salido de la pandemia, sí es cierto, ya se ve una disminución de casos, pero es una realidad y es por lo visto algo con lo cual ya vamos a vivir. Entonces un reto grande para nosotros es buscar estrategias para poder seguir y convivir con esto y seguir trabajando con esto.
Podrán encontrar estos y otros.
You can find this and these and other stories in our publication, Going Beyond Normal. And to give you a brief summary of the content, I introduce you to Pedro Bernal. He's a specialist in the Division of Social Protection and Health of the IDB. During the past years, he's worked in our initiative, Health in Mesoamerica, and he's one of the authors of this publication. Thank you, Carolina. During the past 2 years, our lives have experienced an enormous shift. The way in which we work has changed, the way in which children attend school, the way in which we socialize, and also the way in which we receive health services. And not only that, but also, as we've just heard and seen in these stories, health personnel had to face very difficult challenges, and the health system has been in a state of crisis during these 2 years. And a question that we frequently ask ourselves, and we have constantly asked ourselves, is when will we go back to normal? Behind this question is the idea that normal were better times when everything was fine. And the reality is that, at least for the health systems of the region, that wasn't so, because there were a series of persistent challenges that have been accentuated with COVID. For example, in the region, there was a high burden of non-communicable diseases. 80% of the diseases, because of these conditions, happen this way. And the health systems are not ready to treat or adequately prevent these diseases. On the other hand, the countries of the region have made very important advances in terms of increasing coverage in health services, but not in the quality of these services. So it is estimated that 70% of the deaths that are preventable are due to a deficient quality in healthcare. And we also have health expenditure, which is low and inefficient. On average, the countries of the region spend approximately half of what OECD countries spend, and some studies indicate that if we had the same levels of efficiency that the countries of the OECD have, the population of our countries could live up to 3 more years. And finally, we have a very limited investment in terms of epidemiological surveillance and preparation for epidemics, and this became more than evident with the arrival of COVID. And evidently, with all these challenges, more than the question of how and when we'll go back to normal, the question that we want to answer is, how can health systems go beyond normal? This is the question that we try to answer in the publication that we've launched today. And for this, we start by trying to understand how the pandemic affected the health systems. So how it affected health services, how it affected the health of the population, and how it affected spending in health. So we'll start with the first question. The pandemic affected the offer or the supply and the demand of health services. On the side of the supply during 2020, most of the countries suspended temporarily their services that were preventive or elective. And aside from this, the supply of services was affected in other ways through the interruption of the supply chain or personnel available to assist in emergencies, and in some cases, as was mentioned in the testimonies, desertion of personnel or abandonment of their jobs. And telemedicine had an accelerated growth in some countries of the region, such as Uruguay, Colombia, and Argentina. On the side of the demand or of the supply, some countries, they started implementing these types of health services during 2020. And one of the main causes was the fear of becoming infected with COVID, and also because of difficulties of access and transportation, because of the lockdown measures. And as a whole, these measures and these changes in supply and demand, what they brought was a drastic reduction and a generalized reduction in the use of health services. And even health services that one would think would not change much, such as emergencies and hospitalizations. In countries such as Brazil, Chile, Salvador, and Mexico, we found that there was a reduction during 2020 from 20 to 40% in hospitalizations in regards to the historic average. On the other hand, preventive service was also significantly affected. For example, based on data by the WHO, key services for children showed reductions between 4 and 5 percentage points in 2020. And although it doesn't sound as much, those declines led to levels of coverage that had not been seen for over 2 decades. On the other side, cancer, for example, treatments, they also declined significantly, almost by 60% in the selection of patients and of treatment. And in the case of Paraguay, for example, we saw this. The attention of chronic diseases was significantly affected. And for example, diabetes, hypertension, this was reduced dramatically, and even hospitalization, which is what we see in this chart, also saw a decline for conditions such as diabetes or hypertensive diseases such as in Chile, Salvador, Mexico. They had a reduction between 6 and 7%, depending on the country and the condition. Now, what happened with regards to the population's health? What is key is that the pandemic has had a devastating impact on the health of the population. Most recent estimates show that the excessive deaths was almost 2.2 million for countries of Latin America as a whole, and at the end of 2021. And although many of these deaths are directly related to COVID, others were indirect, either because of the contingency measures or because of the disruption in health services. Of something that we found and that is very consistent in many countries is that there is an increase in mortality due to chronic diseases such as diabetes or hypertension. For example, here in the countries that we were showing, Salvador, Chile, Brazil, we see between 11 and 50%. Now, these changes that occurred in health services and in the health of the population, they might have consequences in the coming years also. For example, the reduction in cancer treatment and selection. There will be an increase in the seriousness of cancers at the time of the detection, which will affect mortality because of this condition. And this can also increase the number of complications and deaths because of these diseases. And now the region also faces new challenges. For example, there was an increase in the prevalence of anxiety and depression in the countries of the region. And it's calculated that there was an increase of almost 30% in Latin America. And there are other diseases such as long COVID, in which health systems not only have to understand this, but also tend to it. Now, what happened as to health spending? In a natural way, it was expected that per capita expenditure in health would increase from 2 to 3% in the next 30 years. And the pandemic has brought new expenditure needs because of treatment of COVID, because of new diseases such as long COVID, and now the gaps that were caused by the interruption of health care. And there's also a very reduced budget because there's been an increase in deficit as well as the level of indebtedness. And now more than ever, more efficiency of health spending is required. And finally, how can these health systems go beyond normal? In the publication, we include a series of detailed recommendations, but here, because of time constraints, I'm going to be very, very brief. The first thing that we have to do is invest in public health. The pandemic made it clear that health is fundamental for all our societies, and to invest in public health to be able to prevent, detect, and contain epidemics is fundamental. Second, we have to accelerate progress towards universal coverage in health. This is an agenda that has still not ended in the region and now becomes more relevant because of all the disruptions that we've seen in health. The digital transformation of public health is vital. Digital technologies can actually be very promising because this could be a way in which we can increase efficiency, access, and the quality of health services. And finally, we have to reactivate and strengthen the regional integration of policies in health. The pandemic also made clear that what happens in terms of health policy at a local level is also closely linked to what happens globally, and to have cooperation mechanisms that will allow us to leverage the limited health resources and optimize diagnostic networks and have regulatory frameworks that are common in the region. These can be very useful for our countries. And as you've seen, the region and health systems face great challenges in the coming years. And we hope that this study that we invite you to download can shed some light on these new challenges and the way of addressing them. Thank you very much. Thank you very much, Pedro, for this presentation. And to have impressions and thoughts on this, we have a panel with special guests. I give the floor to our moderator, Pablo Ibarrarán, head of the Division of Social Protection and Health of the IDB, so that he can lead the panel. Thank you. Thank you very much, Carolina, and thank you very much, Pedro, also for the presentation. First of all, I would like to recognize and acknowledge the effort of SPH and the bank for all the work that they've carried out during all these years to respond to the pandemic with the operations of the bank. Many hours have been required to support our member countries during these difficult times, and also a lot of collaboration and coordination with other areas of the bank. And of course, a special recognition to the health personnel in the countries for their effort for saving lives during these years under such complicated situations as what we saw in the videos. As Ferdinando mentioned at the beginning, health is fundamental to for the recovery of the region in this crisis. And as was made clear in the publication that we present and in the slides presented by Pedro, we have to aspire to something much better than what we had before. Not only reestablish the levels of quality that we had before, but to improve them and to do it with equality, with equity. And for this, I'm very pleased to moderate this event and to welcome our two panelists, Dr. Midori de Habich and Dr. Eduardo González-Pier. Midori is an economist with over 25 years of experience in research, design, and implementation of policies. She is currently the technical director of the sustainability project of the local health system of USAID. She was Minister of Health of Peru and led the comprehensive reform in Peru in order to advance towards universal health coverage. On his part, Eduardo works as a Senior Technical Director of Financing in Health and Palladium. He also has 25 years experience in health and social security. He has contributed to the development of health policies in Mexico with important reforms. And for several years, he was Vice Minister of Health of Mexico. So it's truly a pleasure to have them with us. I remind you all that you can post your questions in the Q&A box at the bottom of your screen. While you submit your questions, or until you submit your questions, I will begin with the first ones that I've prepared. The first one is for Midori. Midori, you've written about the substantial progress in Peru and other countries that have achieved the universal coverage of health services. Given these advances, were you surprised by the way in which COVID-19 affected the health services in the region? Well, first of all, thank you very much for the invitation, for the opportunity to comment on a document that is so important and timely. As we said a moment ago, we are going through a moment in which we want to acknowledge the importance of documenting good and bad experiences to be able to learn. This has been an extremely costly process, and we can't just let it go without studying it, without recording it. And to answer the question, yes, surprises at different levels. And I think that we have shared this. All the health systems were under stress because of this shock, even the ones that we consider more robust and mature. The capacity and the preparation of the countries to these emergencies, epidemics, the information that we had is that there was a set of countries with more income that were in a situation that was substantially better than other countries of medium and low income. And in the end, what we saw is that information wasn't actually reflecting the situation of the health systems at a global level. So to have information that is more realistic in the way in which we collect this information, it's also a lesson. I was surprised by how ineffective and imbalanced the global response was to the pandemic, and that is also something that is very important and will lead to substantial reforms with regards to global health. And I was also surprised in Latin America by the lack of joint or regional action among the countries, although the region has multiple platforms and spaces, agreements, cooperation agreements among countries and regional institutions, multi-country. But however, in my perspective, I was surprised to see that we were unable to have a joint action that was stronger and a stronger voice also at a global level. Another thing that surprised me very much, and that I also think is a core matter in this discussion, is that this pandemic that is fundamentally a public health problem, some of the countries of the region faced this from a hospital perspective. And this is surely because there was the recognition of a weakness in public health, a very big or large weakness in testing and contact, the capacity of laboratories that we had not really paid close attention to. And with this, I want to finish. All these things are agendas that we need to address. And fundamentally, I have felt that we had an international discussion, a national discussion, a local one on universal health coverage, but somehow thinking that this part of public health was something that we knew how to do and that the ministries were experienced in this, and we have not developed these two urgencies in a more conceptual manner, how to include universal coverage, and also through this, the strengthening of public health and of our capacity to respond to these shocks. And I think that that is a task that is pending. We somehow continue to talk about public health on one hand, universal health coverage on the other, and we have to integrate these two concepts that we have on both sides. And well, I will stop here. Okay, thank you very much for your answer. And it is very interesting to see how we can include these public health matters in the discussion of universal coverage and to give a more adequate response to the levels and all the problems that we saw at the beginning in terms of testing and to have the capacity to respond. And we will also talk about regional matters. So thank you very much. The next question is for Eduardo. In this publication, we have documented the way in which the majority of the health services that are not directly related to COVID, they saw a decline during the first months of the pandemic, obviously because of the lockdowns, et cetera. And then they've started to return to their pre-pandemic levels during 2021. What are your thoughts on the resilience of health systems and the possibility of once again providing these essential services? Thank you for the question. And I also want to express my gratitude for this invitation, and I want to congratulate you for this excellent study that the IDB team has prepared. I hope this is one of many that invite us to think about these things, and the idea is to understand what has happened. I think that it's still not very clear, and little by little we will assimilate what has happened. And a way of going beyond normal is to come out strengthened, so to build much better systems, more robust, more reliable. I think that the way of understanding what happened and how we're going to return to pre-pandemic levels, that will not be the same. We're going to have different levels in their composition and scope. And we have to look at this from the side of the needs and also the response by the system. I think in the document makes an excellent analysis for health systems, and it's that there's a combination of effects that are going to make the needs return, but they will return changed. First of all, the sequels of COVID patients. We know that many people were infected. Fortunately, they recovered, but we still do not understand what this will mean in terms of needs. It is clear that there will be needs, for example, of mental health service. And we have this long COVID that we're still trying to analyze clinically and the sequels that this might have on the population and the health demands associated to hospitalization, medical care, et cetera. We do not know this, and we have to understand this. So there are going to be more needs because of this first effect. The second effect, and that the document also does presents in a very clear and convincing ways, the interruption or the delays, for example, cancers that were not detected on time. If they were detected, they were not treated sufficiently. So this means, for example, diabetics that did not receive treatment, and therefore this generated a damage, and also a series of chronic, permanent damages that will make the system receive more attention that need for attention that what it would normally have received because of this very important pause during these 2 years. But there's also something more that is very complex. This pandemic had an effect on the health of a vulnerable population. And I compare to the pandemic of 1918, a pandemic of an influenza pandemic that mainly affected young adults, healthy adults. This pandemic affected vulnerable population, adults, and particularly with comorbidities. So unfortunately, this means that those 2.2 million people that died in the region were also a population that had a high need of attention, with a combination of greater attention effects, more population that will not require the service, because what happened was an advance of mortality. So the excess that we've seen in 2020 and 2021, and that we will see in 2022 will be mortality that we would have seen in the next 5 years. So in that sense, there's a composition of the profile of the demand of attention that we have to understand very well.
On the supply side, which is even more interesting, and I'll focus on the main component, which is healthcare human resources. A number of important things happened, mainly the death of healthcare professionals, and they will not be easily replaced. You may have the budget, but not necessarily the trained, skilled personnel for replacement. WHO estimates worldwide between January 2020 and May 2021, 15,000 deaths among healthcare professionals, 30% of that in the region, and that personnel will not be available to respond to the pandemic in coming years. The second very important point is the lasting reduction in the number of healthcare professionals. As Dr. Villegas said, many countries saw many professionals leave. I'm aware of the Mexican social health insurance scheme. Many workers, especially 60 plus, felt at risk and they retired early as a way of protecting themselves instead of continuing to serve. So they pulled out of the workforce, which led to a shortfall which will be difficult to make up for in the coming years. We need to rebuild the staffing, which will take decades of training. So we'll need to work in order to understand what targeted policies are required by healthcare systems in order to fill the gaps in the short term. Technology helps. It's not a panacea, but we need to see how to offer proper care without the number of resources we had pre-pandemic. And the third point of concern, somewhat harder to get across, is the harm to the trust and confidence in institutions. The lack of PPE, for example, Dr. Villegas mentioned this. Doctors and nurses needed to know what patient they were going to unplug in ICU, which creates a detachment and causes damage to trust in institutions, in addition to the credibility issues. At the end of that day, it has an impact on the institutional standards, on the closeness, quality, and warmth of care. So it's also about the moral and trust capital that we can't quantify, but it's very important to take it into account when dealing with resilience. And I think that's going to be another very important effect that we need to deal with through properly designed policies with a view to understanding how to get back on track for an improved healthcare system. And for that, we need to know what policies can take us to normal or to an enhanced normal. Thank you. Thank you very much, Eduardo. I think you've raised some very interesting points, which certainly are relevant to planning investments and strategies in this very challenging context, while at the same time maintaining the momentum as the health agenda is highly visible. May I remind participants, we have already received several questions, but just feel free to send us your questions. Midori, back to you. The publication describes some of the negative changes, such as in the epidemiological profile. Long COVID is a case in point. Some of this Eduardo pointed out, but what do you think are the changes that will have the greatest impact in the longer term when you look at the healthcare systems in the region? Well, something that has stuck with me from the text is that the load of excess mortality has had an impact on life expectancy in the region, which is now at levels that reflect the situation 20 years ago. I think that statement poignantly describes the seriousness of the impact of these shocks on our health, social, and even political systems. I believe it is very important to emphasize this and disseminate the information and stress this, as some surveys I see in my own country show that the degree of urgency of problems reflects some COVID fatigue in the population and in policy makers. You will see this ranking number 7. Before that comes work, jobs, and other areas that have been heavily affected by COVID. So having the information and communicating it appropriately is key. We are in a crisis. Poverty levels have increased as well. So it is imperative to quickly act in the medium and short term to break this perverse, vicious circle, poverty, poor health. I think we're at a juncture that makes it crucial to deal with structural issues. These changes, which Eduardo has aptly described regarding the health status and the disease load, or the service, the care that has not been delivered, the deficit in health care, the gaps in care, that is something that systems need to duly recognize. And if we look at the more profound changes, what are the healthcare system changes that there seems to be consensus on, at least on the part of academia, and accordingly, we should again take a look at primary healthcare, and this is not new. I think primary care now faces novel challenges. There's still an unfinished agenda that faces new challenges. You need to enhance the preventive side of things, better mainstreaming the social determinants of healthcare in primary care, so as to see how to have new generations of professionals, healthcare professionals, that will have a lens to look at those determinants. We should also, of course, raise the pay in the systems, because, of course, if we don't offer proper health care in the primary level, it's only natural that we'll see many of the problems we are already familiar with. And primary healthcare should also improve its preparedness for shocks, to deal with them. The document has duly reflected the decline in healthcare and the consequences this has had for health. In my own country, regrettably, at the beginning of the pandemic, the primary health care segment was closed. You can imagine what that meant and what it has meant in terms of trying to make up for all that undelivered healthcare. So primary care, once again, needs to be put back on the agenda with these additional challenges now. And the question I ask has to do with the certain optimism, so to speak, we felt in terms of the opportunities that the pandemic could bring in order to attract attention to the sector and also in terms of the resources needed to deal with the challenges, creating closer links between the ministries of the economy and the health ministries like never before, probably. We need to try and build on that going forward and maintaining healthcare appropriately. And this is an idea that we have been working on, which is to build stronger systems. And I think part of this has to do with recognizing and recalling new and old priorities based on our learnings and better aligning resources vis-a-vis such priorities. This is certainly a task for the medium and longer term as well. So we can take advantage of this time where the population, citizens, and authorities have an eye out for the priorities, and hopefully the resources will be made available for the fundamental structural changes required in our health systems. And there's limited fiscal space, as we know, so we should also enhance the efficiency in the allocation and use of resources, especially the additional resources required. That is key, as well as improving the quality of spending, which entails a whole lot of things. But essentially, it means some very concrete things, such as improving the capacity of execution and absorption in the health sectors with regard to resources. And the other fundamental point is corruption. That should figure prominently on the agenda. On a positive note, we have seen flexibility in budgetary execution to quickly respond to the needs that have arisen, and those are good lessons going forward, but we should also look carefully at the balance in between flexibility and corruption risks. Many of these are not new matters on our agendas, but we think COVID has somehow given us a new lens to see through. Indeed, thank you very much, Midori. I think the pandemic has exacerbated many inequalities and fragilities. We see this setback or loss of life expectancy. In 10 months, we have lost 10 years in terms of progress, women participation, among other things, and recovery has proven very slow. So thank you very much for highlighting those points. And before moving on to the audience's questions, Eduardo, we'd like to ask you for your thoughts on this. We face the same challenges, but worse and with significant restrictions, as you said, in terms of personnel, for instance, human resources. How do you think that the health systems could manage, or what reforms are needed in order to deal with these new and pent-up challenges, considering also these restrictions when it comes to responding? That's a very good point, and I agree with Midori's remarks. These are traditional recommendations and policies. We can't reinvent the things that have been proven to work for decades, but perhaps the angle, the perspective and the justifications may have changed. And I will focus on a couple of things. Investing more in health is one of the key 8 recommendations in the document. We know that the region underinvests, but one thing that the pandemic has made abundantly clear is the two-way effect between the economy and health. We know that a strong, functioning economy generates revenue, income for health, and there's fiscal space to finance the health system. But what wasn't as clear, and I think now is, at least the way I see it, is that a strong health system also protects the economy, as it protects jobs, it protects the ability to finance many sources that are key for economic performance. Tourism, transport, among other sectors very closely dependent on health apart from the medical system. So there's a need for this symbiosis between health and economic performance that needs to be taken into account more clearly than ever before. And these are reasons to finance health because it'll lead to better health, but also because of the good economic effects. A second effect that's been made clear is the importance of intersectoral policies. We knew this before. It was very clear, and it had been highlighted in the policy on the fight against non-transmissible disease. But now this has taken on even greater visibility, as it's clear that one way to prevent and fight infections is a very good linkage between the health and education sectors in order to coordinate work in the educational sector, also in coordination with transport, with tourism, and also some very important scope for inter-sectoral cooperation, which existed before. But I think it's become particularly important to see how important it is to have the proper governance across sectors. It's difficult to achieve, but it's very important in order to improve health conditions. And the third point, I think, is particularly important, and I regard it as one of the key lessons of the pandemic, is that the government health sector is strategic to respond to pandemics and to health needs generally, but it's not the only actor. The private sector and organized civil society also have a fundamental role to play in the health care response generally and in dealing with pandemics in particular. And we've seen this. We've seen how civil society and the business sector protected the workers, providing income beyond what was strictly required by law. We see how gyms, hotels, convention centers were converted to offer emergency response to COVID when public hospitals were overflowed. We saw donations by the business sector. We saw gifts of PPE and other altruistic sorts of donations. So that is the sort of response we need. We can't expect just the government to be in charge. We need private participation. Let's not forget that in our region, over half health expenditure is in the private sector. So we need a much broader approach. I mentioned this when I talked about the economic dimension, the intersectoral dimension, and the private and public and social interaction in dealing with healthcare and pandemic management. Yes, thank you very much, Eduardo. These are very important points. Clearly, health has an impact on the economy and on well-being and on the ability of our societies to function. And there are clearly more actors. As already mentioned, there's the social determinants and many actors that have a role to play in addressing these situations. I'd like to take some of the questions from our audience. Thank you very much to all those of you who've taken part. And one first question I would like to ask Midori is, what specific gender-related considerations have come into play from the health care perspective, or what should have been considered in that regard when dealing with COVID? We have seen many of the social effects that obviously affected women much more, but in health terms, any thoughts on that? A very important question. Although we know that COVID has affected more men than women, the indirect effects, again, through a gender equality angle, considering also the disruption in services, you know, family planning services, reproductive health services were seriously affected. And I don't have precise figures, but I dare say that is one of the services that was relegated right from the start in terms of lack of access to family planning, which will, of course, have a huge impact going forward. And even now, we can see that very unfortunately, we have seen an increase in maternal death rates. I think our countries are only just starting to see early figures on maternal deaths. I think that the whole maternal and child health services or services with a focus on adolescents and young women, fertility, that's one of the areas that has suffered most, and that has lasting consequences, no doubt about that. And this is also related to this major challenge that one could highlight going forward, the fact that we need a healthcare system that will be able to work in the face of such shocks and keep these essential services running, as this is a very painful conclusion. Ministries became COVID ministries. You couldn't talk about anything other than COVID. You couldn't advance any other policies or foster improvements that were not related to COVID. They became COVID ministries, and many of them still are, and they're finding it hard to get over that. And among essential services, we should particularly seek to protect the lives of women, young girls, and adolescents. And another thing is domestic violence in the COVID context. Having families in lockdown, you know, domestic violence, sexual violence, some very painful issues that we'll have to deal with. We need to study this, as Eduardo says, we need to document this. That's the only way. We need to learn and find ways to deal with that, because there has been a disruption in the social and family aspects as well. Thank you. Eduardo, there have also been questions regarding the preparedness and response capability of countries. For instance, when we look at vaccine productions and the progress in Africa in terms of having a CDC, a regulatory center to ensure some coordination. What is your opinion regarding the possibilities for something like this in Latin America with a very significant participation on the part of the private sector to develop this industry, which currently doesn't really exist? Well, I'll be a bit critical. Midori also highlighted this. These systems stress, or these situations stress healthcare, and we see things that we would otherwise not see, such as the gap between what is said and what is done. We have seen little solidarity between countries in the region, but I think what was particularly poignant was the lack of North-South solidarity developed vis-a-vis developing countries. We saw this in terms of PPE, of ventilators, and more recently in terms of vaccines. I think one of the takeaways is that there's talk about equity or equality, but when a pandemic strikes, countries first try to find their own personnel and resources, and obviously will focus on having their own vaccines before helping poorer countries. So poorer countries will have to find their own ways through production capacity or arrangements, so that in case of any contingency, they will have supply guarantees in new production formats. So we need to understand what actually happens and what does not happen when a pandemic strikes, what the rationale is. Of course, countries have to respond to their constituents and to their own domestic pressures, so there are constraints on international solidarity. We need to live with this, we need to acknowledge this, react, and prepare. Thank you very much. Yes, I think those are very important issues, and that's precisely what's being discussed. The region's capacity in order to be able to have a certain level. Well, there's the LAC study on health self-sufficiency, right? We've only got a few minutes left, so could I ask you in just a minute to comment on this? One of the points you have particularly highlighted has been mental health. What would be some next steps you would recommend for healthcare system to deal with this, which is something that, again, was already on the agenda before the pandemic, but was clearly compounded by it. Midori, you go first, please, and then Eduardo. Yes, this is an area in which we've always experienced a major lack. We've had a defective approach even before COVID. And there have been some interesting experiences in terms of dehospitalizing mental health. And I think this is a very broad area. Health systems are not well armed to deal with these issues. We need to move fast. And I think there are two human groups that need to be prioritized: children and adolescents in schools. We can reach out to them with mental health support through schools. I think generally we should regard schools as a space to deliver health care services and support for teenagers, for adolescents who suffered tremendously. The youth suicide trends is also deeply disturbing. So there's room to work in the school context, also with regard to food. That is another area that we could discuss in greater depth. And as Eduardo rightly pointed out, some studies, including some we have done, the project in Colombia on stress and health care personnel exhaustion, shows truly shocking levels. Over 80% personnel feeling worn out, exhausted, and stressed out. We won't be able to aspire to a resilient health care systems if the main health effectors, the main health agents are in very compromised mental health situations. That's very important. And again, we shouldn't try to do this alone. I think we can work together, our countries, in order to see what is actually working, what experiences are available, and what it is we can set into motion in the short term, and of course, making a point of keeping that running in the medium and longer term. And let me just take 1 minute to talk about digital transformation. The digital transformation element I would like to highlight is, if we don't have digital transformation, we won't be able to advance to unify our systems or to reduce the fragmentation in our systems. I think that's where we should start, and that should be #1 as a priority for all of the reasons you've noted, and also due to the fragmentation in Latin American healthcare systems. Thank you. Thank you very much indeed. Eduardo? I share those mental health related concerns, and there will be many more that we probably can't even imagine. There will be an impact in the generation of youths that have suffered the crisis. We still will have to see the consequence of the gap in the educational system and the sort of insecurity this will lead to. I would like to wrap up, Pablo, with a comment on the importance and responsibility in terms of keeping this alive on the agenda as a topic and making sure that all of this is mainstreamed. We need to improve and learn. I am concerned. I see there's a concern and a need to turn over a new leaf. It's sometimes forgotten that this has been an unprecedented health and economic crisis. A crisis on such a scale requires serious thinking and policy changes. We all agree it will not be the last pandemic we'll experience, and in that vein, policies to keep this on the agenda, to keep interest is important. If something is not on the agenda, it will not get any funds. So I would like to go back to where I started. I'd like to congratulate the bank and the team, as this document is one of those ways to keep the discussion alive. And we hope in the next few months, we'll see concrete policies to improve our health system. Thank you very much, Eduardo. Clearly, we need to keep this alive. And there is a certain tendency, you know, there are many distracting factors, it's true, as there are so many other challenges, but we should keep the focus. I would like to thank you once again for being with us, participating, Pedro and all of the team that worked with him to prepare the publication. I'd like to thank you for joining us, and I would also like to remind you to download the publication through the link that is now being included in the chat. And if you're interested in health and social protection, of course, another group that was affected by the pandemic was older persons. So we'd like to invite you to the next seminar on Thursday, 26th May at 10 a.m. Washington time to see how to build successful care systems. We'll have Julio Bango, an expert from Uruguay, and we'll leave the link for you to register in the chat. Thank you very much, Eduardo, Midori, and Pedro, for your participation. Have a great rest of the day. Goodbye. Thank you.